Now we see the management of dengue summarized. We just outline how do we manage the patients who get dengue fever. Now, what is dengue? It's actually a viral infection. It's a febrile illness which is self-limiting, usually without consequences, but some of the patient may have complications. The most dreaded complication is the plasma leakage. The fluid leaks from the intravascular compartment into the extravascular compartment, compromising the circulatory volume. The perfusion drops, and if not handled properly, can result in organ dysfunction and serious consequences. Now, when we get a patient of dengue, what we do, you got three phases. You got a febrile phase, and then there is a recovery phase. In between, some of the patients develop a critical phase during which the fluid leaks. So during the initial portion, we monitor the CBC daily, and what we see in the CBC is the hematocrit. What is happening to the hematocrit? Hematocrit either remains stable, it rises, or it falls. So there are three possibilities. It remains static, it rises, or it falls. And along with the hematocrit, we take certain clinical parameters, that is the clinical indicators of circulating volume. Is it perfusion going on normally or not normally? So among this, we take the vitals of the patients, which include the pulse rate, the pulse pressure, the blood pressure, the urine flow rate, and the capillary refill time. So with these two parameters, we can have a fair idea of what is going on inside the patient. So it's hematocrit which is important, and the indicators of circulating volume or the indicators of tissue perfusion. We look for this and we can find out what is happening, and upon this we design our management plan. So these two are very important, the hematocrit and the indicators of perfusion. Now, there may be one situation when the hematocrit is rising. When the hematocrit is rising, it means the blood is becoming more thick. Now, why it can be? The one reason can be simply patient is febrile. The patients get dehydrated because there is a lot of fluid lost from the skin as insensible losses. There is loss from the respiration. Patient may have anorexia. Patient may not be taking enough fluids, or patient may be vomiting. So these patients tend to have some rise in hematocrit. Now, these patients usually maintain their vitals, the blood pressure, the pulse pressure, the urine flow rate, and the capillary refill is usually normal. So these patients can be put on or encouraged to have oral replacement of fluid. And in a very few patients, when they are having persistent vomiting, we may need intravenous fluid replacement. But then generally these patients go very well on oral replacement of the fluids. And then a second reason the hematocrit becomes high, the blood becomes thick, is because of the plasma leakage. Plasma leakage is a serious business. And you see, in plasma leakage, the indicators of perfusion, they deteriorate. The pulse rate starts rising, the pulse pressure starts decreasing, the blood pressure starts decreasing, the urine flow rate decreases, and the capillary refill time is increasing. So we've got two parameters which start rising, and there are a few parameters which starts falling. The pulse starts rising, and the capillary refill time starts rising, while the pulse pressure, the blood pressure, and urine flow rate decreasing. So they tell us that the patient is going into leaking phase, which can be confirmed on ultrasound when you see there are fluid in the cavities like peritoneum, or there may be pleural effusions. So we can confirm that. But these clinical parameters, they do suggest that the patient is going into this phase. And then this is treated with a matching infusion of fluid. So we monitor the patients very closely and adjust the amount of fluid required for the amount of fluid which is leaking. So this can be a very tricky situation, and this is the key step in the management of patients who've gone into the leak phase. And then you got a situation when the hematocrit is falling. The hematocrit can fall because of dilution, the blood becomes thin, or the hematocrit can fall because the patient bleeds. So when the hematocrit is rising, it is actually either there is increased fluid given orally or intravenously, or the patient is reabsorbing fluid. While if the hematocrit is falling, this could be because of blood thinning, or it could be because of patient bleeding. So now see one by one. When there is a fall in the hematocrit, usually less than 10 points from the baseline, the possibility is that patient's inappropriate fluid intake. And this fluid can be oral or intravenous, and we should keep a record or track of what sort of fluid patient has been taking in the past 24 to 48 hours. So that tells us that this fall in hematocrit is because of increased fluid intake, and this usually is seen in the febrile phase if the patient is taking more fluid. And then you see there is reabsorption of absorbed fluid. When there is the plasma leakage phase after 48 hours, this leakage phase stops and the fluid which has gone out of the intravascular compartment starts coming back. That results in thinning of the blood. The hematocrit starts falling. So this is again the time when you have to really monitor the patient to reduce the fluid according to the patient's vitals. What happens in the resorptive phase is the vitals, they start improving. The indicators of low perfusion, they start improving. The patient's pulse pressure starts getting better. The tissue perfusion starts getting better. The urine flow starts getting better. The blood pressure comes up. Tachycardia goes down. Capillary refill time starts decreasing, and this is the time when you have to reduce the fluid. If you keep on giving more fluids, that will result in circulatory overload. And then we see a situation when the hematocrit is falling and it's fallen more than 10 units from the baseline. The patient is most likely bleeding. Now, how to differentiate this situation from a situation when patient's hematocrit is falling because of the reabsorption of the fluid which is leaked. So it's the vital signs which can help us here. In patients who are bleeding, they tend to have low vascular volume, and the indicators of circulating volume or the perfusion, they start becoming abnormal. The patient has tachycardia, patient has low blood pressure, there may be diminished urine output, and there may be decreased capillary refill time in the periphery. While in patients who are having the drop in hematocrit because of the reabsorption of the fluid, their blood pressure, their pulse pressure, they improve, the tachycardia settles, the urine output improves, and the patient's capillary refill time also starts decreasing. In these patients, we decrease the fluid intake, while patients who are bleeding, we transfuse them because they need blood. So these are the two situations which are again a little tricky in patients who got this dengue. Either the hematocrit is falling because of the reabsorption or it's because of the bleeding. If it is more than 10 points, we usually consider bleeding, especially if the perfusion pressure parameters or the circulating volume parameters are abnormal. And in reabsorption, these parameters, they start becoming normal. So in this situation, when the hematocrit is falling, the vitals, they become important. In reabsorption, vitals normalize, while in bleeding, the vitals, they start deteriorating. So this is how we differentiate these situations, and depending upon these circumstances, we design our treatment for patients who got dengue fever.